Hey, good morning. Good morning, everyone. Happy Thursday. That's right. I don't know, I wanted Thursday so bad yesterday. I was operating on Thursday, but today is Thursday. And welcome to the broadcast. My name is Angela McGowan. I'm your professional healthcare advocate, caregiver strategist, author, and publisher of this book. What you don't know could kill you, How to Get Out of the Hospital Alive. Yes, and I am the good morning, and I am the founder of Angie's Pace. Hey, Elaine, good morning. That's Patient Advocates Committed to Excellence. So that's who I am, and thank you for joining the broadcast on this morning. We are still in our series about medical errors, and listen, medical errors is a huge topic. We're just covering one, misdiagnosis. I'm sure you bet I couldn't do it for 5 days. I actually could probably do it for 10, but I'm bringing it in for 5 full days about medical errors. So let's do a quick review for those who may not have been with us. And first of all, medical errors is the number 3 killer of Americans, but it's not on the CDC's list of top 10. Why is that? Because there's no place for medical errors to be checked off on the death certificate. That's the reason they have. That's what they're saying. But regardless, I still say emphatically, having the right primary care physician is so very important. It is definitely a game changer with your survival rate. Let me just put it like that. And being comfortable to ask your providers, all of them, but definitely your primary care providers, questions, multiple questions if necessary, about the advice that they're giving you after you continue to tell them about the symptoms and what's going on your healthcare journey. So a powerful patient has no problem with this because a powerful patient is positive, persistent, prepared, passionate, and on purpose. And a powerful patient will continue to keep asking the hard questions. Hard questions like, are there alternative treatments? Is this the best one? And every patient, no matter what, if you consider yourself a doctor's patient, you're trying to be a powerful patient, no matter what diagnosis you get, you should say these 4 words. Could it be something else? Especially if the plan of care and the treatment don't equal to what you're feeling, or something deep on the inside like, this is just not how it goes. So you want to think about that. And say it confidently, say it with conviction. Could it be something else? Because this is your life. And if it's your parents' life, whoever's life it is, it's their life. And so remember, the doctor took the Hippocratic oath for what? That they are what? Practicing medicine. This is not without fault, and this does not mean it cannot go wrong. Definitely. And statistics show straight across the board when it comes to misdiagnosis, 10 to 30% is happening in the United States, okay? And that's according to the Healthcare Research Agency for Health Quality. And then in your ER, where we're running to, we don't want to go to the doctor, we'll just go straight to the ER. 40%, not 10, no, straight across, 40% of the diagnoses in the ER are wrong. That's why I say without question again, when you do go to ER, make sure you do the follow-up, be it to the PCP specialist, wherever else they're sending you, do the follow-up. It doesn't matter if you're feeling better. Yes. And your husband is 100% right. They are practicing. When they take that oath, that's what they say. We are practicing, okay? Now, for most misdiagnosis, let's put it like this, of patients, listen, it may not result in a different way that's going to be treated. You know, be it the flu and bronchitis. You might still get the same thing. But the point is, it's wrong, okay? That's the main point. So it doesn't necessarily mean that you have the wrong treatment or whatever. But there are times when the wrong diagnosis will put you inside of a wrong treatment, and those medications will do something to you where it will create new and different symptoms. All right, like somebody with something simple as a rash. Okay, even if the rash goes away, it doesn't mean that that rash wasn't a sign of something that could ultimately kill that person. So you definitely don't want to even take, oh, it's just a rash. No, it's not more than, it's more than just a rash. Hey, Roxanne, what's going on, sis? How are you? So in my book, I have that whole chapter on mass diagnosis, misdiagnosis, and delayed diagnosis. Let me read to you about the sections about misdiagnosis and why it occurs so frequently. It was found that patients have 25 seconds to speak to their physician before being interrupted and redirected to what the physician wants to discuss or confirm. Just this year, it has been documented that the amount of time that you as the patient will have the opportunity to give clarity of your symptoms or ask questions is now 11 seconds. And then you will be interrupted by the physician to clearly decide via persuasion and time constraints to agree to the medical recommendations, which gets you out of the room as soon as possible and on to the next patient. How about that? You get interrupted and redirected. So what do you normally do? You lose your train of thought, and you are also dealing with what thought process that the doctor is the expert. So let's talk about what may have happened to you. See if this has happened to you when you've gone to the doctor or someone you know. The doctor, you've gone there with complaints, you've done the test, the doctor says, I can't find anything, okay? Those symptoms, they'll pass. There's nothing for you to worry about. And after that, you're invited to come back to the doctor's office in 6 months, and they'll do a check on you again. Now, this is something that there's a lot of documented information about when it comes to women and the lumps that they find in the breast that are often, they're told there are fibroid tumors, different things like that, scar tissue if they've had tumors removed before, it's just scar tissue that's formed there. And many women, when this goes on, when they find a lump or another one, the ones that trust that voice on the inside and follow through and get a second opinion, find they do in fact have breast cancer, they get treatment and they live. But what happens to the ones who come back 6 months later and find that not only is it breast cancer, but it's a different stage? Okay. Among women, as I told you point blank, more misdiagnosis goes on. First of all, because we go to the doctor more, right? We don't just write it off. But more common misdiagnosis for women is heart disease, thyroid disease, ovarian cancer, other female cancers, chronic fatigue syndrome, and fibromyalgia. Now, let's not forget, let's put it in perspective. Heart disease is the #1 killer of Americans, men and women. So for more women to be misdiagnosed for that, that's a sign we need to take that into account when somebody's telling us to come back in 6 months. And regardless of the cancer types that I mentioned for women, the family of cancers as a whole is the #2 killer of Americans, both male and female. So remember, you're coming back in 6 months for the #1 or the #2 killer that you think is something's wrong with you, and they're saying, we just don't know. It doesn't seem like there's anything wrong. Come back in 6 months. And for men, of course, it's prostate and colon cancer. And, there's different reasons why that's missed. But the biggest reason, especially for colon cancer and prostate, they don't go to the doctor and get their annual check. Colon is because they won't get that colonoscopy. Okay, and that is the one that has like a 95 to 98% cure rate, and that's for both men and women. So overall, the most common misdiagnoses are heart attacks, appendicitis, breast cancer, colorectal cancer, and lung cancer. And depending on the symptoms, those are the ones you're invited to come back, check them out in about 6 months. So I said, and I'm going to tell you again, how do we respond to misdiagnosis? Like, just on the inside, it doesn't feel right. Don't sit for a time of indecision. Get out there and get yourself a second appointment, getting a second opinion, okay? If for whatever reason your insurance is like, well, you're going to somebody outside the network, let me tell you, it is well worth it to pay that $40, $50, whatever it is, to go outside the network than to come back 6 months later in the network and have one of these fatal diseases. And I'm sure you would agree with me. Okay, because we have a false sense of loyalty, sometimes intimidation from our practitioners, and we don't stick up for ourselves. And that's something we have to do. Now, the next thing I want to touch on is failure to diagnose, just as huge as misdiagnosis. Okay, so you call your PCP, you're short of breath, stabbing pains, pressure in your rib cage, shoulder pain. They say go straight to the ER. You may be having a heart attack. You go to the ER and they give you all the tests, say nothing's wrong after a few hours, but you should go to a cardiologist. You should go to a specialist. You go there, you have your barrage of tests there. Cardiologist says, didn't have a heart attack, there's nothing wrong. Usually they say you didn't have a heart attack. That's probably the sentence they usually give you, okay? So you're frustrated because you still are having these symptoms. And now, people are saying there's nothing wrong with you. It's not there's nothing wrong with you. It's a failure for them to diagnose what's actually wrong. Those symptoms are real, but you need to know exactly. Hold on, I'm so sorry. I'll do that. Okay. Let me turn this down because I didn't know that. Okay. Yeah. It's a failure to diagnose, and so now you're frustrated. So what's the next thing that they tell you? Okay, the next thing is all in your head. That's right. It's all up here. Okay, so for some reason, I'm sure you could guess, ladies, females are told by their doctor there is nothing wrong with them and the symptoms are all in their head, 10, 20 times more than they would ever say that to a man. Absolutely, okay? So when the doctor is unable to assign a name, giving you the exact diagnosis, that's what they do. Now, doctors will say that, and patients do agree, they want to have a name of something. If they don't get a name, then, it makes them feel like, what do I have? You can't name it. And so these symptoms that are going on, okay, these symptoms that are going on are very real. But this is what the point is. If your doctor feels it's a mental, emotional thing, then why don't they give you a referral to a psychologist or a psychiatrist so that they can verify it? And if it's not all in your head, I'm talking about you. If it's not all in your head, they will write it off and go back to the PCP like, this is not in her head. There is legitimately something wrong. Okay, and this is what I'm going to be talking about next week about minority mental health awareness, because we don't want to be labeled as something's wrong with us up in our head. Okay, we don't mind having some disease, but please don't tell us that we need therapy or, we might be a little off our rock. Don't do that to us. Okay, we don't want that. We want a disease and we want a name for it, okay? And our doctors know that as well. So I'm saying to you, if they can't name it, if someone should say, this is just psychosomatic, whatever, fine. I want you to give me a referral to a psychologist, psychiatrist, whoever my insurance will pay for, because I don't want that to be in my head. And I don't want to feel these pains either. I don't want to feel this discomfort. I said it, I'm telling you again, remember, when you just take anything from your doctor, they're going home and going on with their life while you're at home, with these symptoms, with suffering, and not knowing what to do, not getting the excellent care that you deserve from your benefits. A misdiagnosis or a failure to diagnose, it affects your care, whether you get any or not. It affects the medications, whether they're right for you or not. It affects your family, because everything changes when that goes on with the family. It's going to affect your future, definitely, whether or not you can continue working, whether you need to retire. It's going to affect your finances, Because if you have to change jobs, good Lord, okay, that's definitely, you're living by the grace of God with these jobs anyway. So I always tell you, symptoms are not a diagnosis. That is true, but you should definitely be able to get one. If they don't have one and they feel it's psychosomatic, or that whole mass diagnosis in all women, all my patients, get yourself a referral so that you can rule it out for yourself and for your doctor, and they can stop practicing medicine and go on and actually take care of the situation that is happening to you, or admit they can't and give you another doctor. Sounds like a winning plan to me. Hey, thanks for joining me on today. I'm Angela McGowan, your professional healthcare advocate and your caregiver strategist. I help you navigate through healthcare's sea of red tape. And I create strategies that are going to allow you to give excellent care to those that you love and care for as you care for yourself. Don't forget, you can always come and give me a call, schedule time with me. At my link, Advocate Angie, is bit.ly/Advocate Angie. And go check my website out. Same bit.ly link, but it's Angie's Pace. That's me. And remember, excellent healthcare, it's not a privilege. It's your right. Exercise your right, because guess what? It's also your responsibility. Make sure you have had your annual health care, a screening, checkup according to your age. If you have a spouse, make sure he gets out there. When you're spreading the word about those shoe sales and all the other things we spread the word about, spread the word that, hey, we need to make sure that we take care of ourselves, okay, for our sake and for that of our family. I'm leaving you with those two things. What are they? Blessings, yep, and joy. Why? Because they both belong to you. Have a blessed day. It's Thursday. I'll see you on tomorrow for Happy Friday. And we're still going to be talking about misdiagnosis, but guess what else? Trash can diagnosis. That's right. It'll be here with me tomorrow. Bye, everybody. Thanks for joining. I must have double clicked.